Oh, okay. 10-3. 10-3.
Correct that to 10-3. Colleagues, due to some scheduling concerns, we're going to take a couple of items out of order. So the next item that we'll take, the next issue that we will take is issue 15. It's on page 18 of the agenda, and this is the Office of Planning and Research Precision Medicine. So page 18, issue 15.
That's okay.
The write-up didn't change at all.
Right. Where did my old...
Did Glazer vote? No, he didn't. That's who it was. Yeah, it's 1, 2, 3.
Mr. Euler, we're going to start with you.
The governor's budget proposed $10 million in general fund to fund a grant program for public and nonprofit entities administered by the Office of Planning and Research for precision medicine research. Precision medicine is an emerging approach for disease treatment and prevention that takes into account individual variability in genes, environment, and lifestyle. And while our office hasn't necessarily raised any issues with the potential utility of additional research in this area, we have raised some concerns with the administration's proposal. Broadly speaking, providing state general fund for direct research funding is not a role that the state has commonly played. Much of the state's research institutions receive their funding from federal, private, and other non-state general fund sources. And because of this, this proposal raises some questions about how the state should prioritize funding in this area versus many other potentially worthy areas of research. Our office suggested a few criteria the legislature might want to consider. In particular, is there a good argument that there's a lack of federal and private activity in this area and funding in this area that the state might need to play some role so that there's adequate funding here. A second consideration is whether or not this research would provide some type of benefit that is uniquely important to California and its residents. And I think based on these criteria, we found it hard to justify providing funding for this particular area of research over many other potentially worthwhile research ventures. We also had some concerns just sort of about the administration of the program, and in particular sort of the lack of clarity on how some of the funds would be spent, particularly the administrative funds, which is potentially about $1.5 million of the funding here. The use of those funds, the amount and the number of staff that would fund, that has been fluctuating throughout our conversation with the administration. And we're still sort of lacking some clarity about how that would be spent. So we have some concerns there as well. Because of all this, we have recommended the legislature reject this proposal, and the staff recommendation on this item is to reject.
Thank you, Mr. Euler. Ms. Costa.
Yes, thank you. We still support the administration's proposal for $10 million for precision medicine, which, as the analyst points out, is kind of cutting-edge research. And we have previously funded precision medicine in 2014 to the California Initiative to Advance Precision Medicine, hosted at UCSF and the University of California Health. Previously, projects that were funded included a project focused on improving outcomes for children with cancer, and another project that was focused on infectious disease. Both of these, we think, are a good investment for the public good of the citizens of California.
Just following up on some of the points that Mr. Euler raised, no doubt that there's value in this research. How is it determined that there should be an investment here as opposed to, I'm sure, scores and scores of other opportunities for investment in research? How is this one determined?
Well, I'm going to date myself a little bit here on the UC budget in particular, and years ago we did actually include line items for research for the University of California, and we have since moved to a model in which we're giving them a base allocation. And so, some of those research activities that have been deemed for the greater good for the state are still happening at the University of California. For precision medicine, again, I would just note this is really cutting-edge research and technology, and there has been federal investment in this area recently, and so that's why this particular research has risen to kind of the top of this list.
And again, it was noted that upwards of 15% is likely for administrative costs, including catering, transportation, and hotel accommodations. Any concerns that the proposal is potentially overstaffed and we're not getting quite as much as we might want to or need to out of this $10 million investment for the research it's intended?
All right, Brendan Murphy.
You're on.
There we go. Brendan Murphy with the Department of Finance. The component for, yes, all of those are components inside of the administrative costs, no doubt, but that 15% is mostly at the UCSF to run the entirety of the projects. That is not, those are very small line items inside of a much broader component budget there. And in that, what they're really doing is trying to run these demonstration projects where they are bringing people from all different scientific backgrounds. So you're really trying to mold data models, not just from medicine, but from medicine, technology, and infectious disease, and rolling it into one component project that can then be replicated and used across a broad spectrum of diagnoses, in many instances, not just across California, but possibly in the long term across the world. Because of the unique confluence of all of those things being main players in California, we feel that precision medicine is unique to be funded and ripe to be funded with California money.
Thank you. Senator Mitchell.
Thank you very much, Mr. Chair. At risk of also dating myself with regard to UC investment and research, the breast cancer research program, slightly different, was funded, as I recall, through tobacco tax dollars, but has a very robust, I believe, transparent review and evaluation process. I don't know what their admin rate is. I don't know that it's quite 15%. But when we hear from LAO and some others express concern about the review process, I think similarly, various disciplines are come to the table to engage in the process of granting those research dollars. Is there an opportunity to look at it as a model, perhaps, a more appropriate model in terms of a way to, in a more transparent way, make sure that grants are administered fairly kind of across the board?
I think the initial concern raised was, I hope, somewhat alleviated by the trail bill language that we put forward, which really enunciates not just the original process that they went through with the first $3 million of precision medicine, there we go, as well as what the long-term will look like. And you'll see that it is very similar to many other grant programs that the state has run, like the breast cancer program. It includes a best practices review and outside consultants from across the country who are not applying for the funds to dictate which programs or which projects then rise to the top. And therefore, getting the cream of the crop, trying to move forward the best initiatives in the most cutting-edge fashion.
Do you by any chance know what the admin rate is for the breast cancer research program?
I apologize, I do not.
That'd be helpful, I think, for us to know, to have, 15% kind of sounds outrageous when you hear about travel and hotel, but to compare it to another program that's worked for 20 plus years now, this might be helpful to give us a apples to apples, I think, comparison of what an appropriate, reasonable admin rate should be. Thank you, Mr. Chair.
Good suggestion, Senator Mitchell. Thank you. We have Senator Nielsen and then Senator Roth.
Mr. Chairman, I think and we should discuss this in depth, an administrative cap would be in order, and as well an accountability, a report to the legislature of the expenditures and the protocols for the expenditure. So we know what's the accountability. This right now is just pretty much a blank check. Go do what you want to do with it and report or don't report. I think that's not the wisest way to go. I do believe that we should require some reporting. Senator Mitchell has mentioned how successful the breast cancer project has been with a cap and with reporting. We should require that here, too.
Thank you, Senator Nielsen. Senator Roth.
You know, during the Budget Subcommittee, I made some comments. I'm obviously supportive of research. My father was a college pharmacy professor. I grew up in that environment. I did note from both this material and the material that was presented during the Budget Subcommittee that the vast majority, if not almost the entirety of this research funding is provided by the federal government and by private entities, foundations and the like that are interested in medical research and in particular precision medicine research. One of the things that I tried to suggest in the Budget Subcommittee was that given, in view of all of the needs that we have in the overall healthcare delivery system in the state of California, that I was hoping that administration would show evidence of some prioritization. And when you take that list of needs and you total up the dollars associated with those needs, precision medicine and $10 million can't possibly be at the top of the list. And when I think about the needs in this state for Denti-Cal, which my colleagues have advocated for, the needs in the state for Medi-Cal and Medi-Cal reimbursement increases, the needs in the state across the board with respect to the underserved population, the need for children's health care and increased funding there, I cannot simply support this proposal despite my interest and my enthusiasm for research and in particular medical research. So not a question, Mr. Chair, I just wanted to make those comments. Thank you, sir.
Senator Wolk.
Thank you, Mr. Chair. I guess I date myself as well. The role of the state with respect to research at the University of California has gone in one direction, and it's not up. And when I saw the proposal, I was surprised because it's a one-off proposal. It's not about research. It's not about what the role, what sort of the role of the state should be with respect to research, considering what's happened, the history of it. So I share the concerns of the LAO and my colleagues, Senator Roth. I just don't know where this comes from, where it fits in, and I'm comfortable supporting the staff recommendation to reject it, and I would move that.
Thank you, Senator Wolk. So we do have a motion to follow the LAO's recommendation of rejecting the subcommittee action. We have comments or questions from Senator Morlock and Senator Morlock.
Thank you, Mr. Chair. I'm just curious, what are our results from the demonstration project in 2014-15? And maybe I should preface by saying, you know, what kind of outcomes were we expecting? What were our expectations, and were they fulfilled?
Thank you for the question, Senator. So the two main projects, as Ms. Costa noted, were the California Kids Comparison Project and then the Precision Diagnosis of Acute Infectious Disease. So let me start with the California Kids Cancer Comparison Project, which is led by UC Santa Cruz. The project provides the power of large-scale data processing to improve the outcomes in clinical trials that are underway at UC medical centers to identify new therapies for what before had been incurable tumors, especially often taken in small hindsight, in small samples. So what they're really trying to do is look across the broad construct of what constitutes the tumor, and then look across the entire country for where there are other methods of treating it that have worked, and be able to have a data bank that allows for a doctor, oncologist anywhere in the country to be able to look at and say, these are some other methods that have worked to treat similar tumors in children in other places. The project analyzes each patient's tumor in the context of thousands of pediatric and adult tumors that have undergone similar characterizations and allows them to treat accordingly. So where that's at right now is that project is coming to a conclusion, and it has allowed them to identify a number of specific tumors and categorize them, and then start to categorize the ways that similar tumors have been treated, allowing for hopefully better oncological treatment into the future.
Well, maybe I can interrupt you and ask it a little differently. We're making an investment, and somehow we should be able to convert that into a licensing agreement or a royalty. I mean, are we doing it to raise revenues, or are we just being altruistic and saying, here's a project for medical students? Or I'm trying to figure out what we're doing.
So we're doing it to be altruistic, sir.
Okay, then another question. We had Prop 71 in 2004, and that was very specific with stem cell research. Has that been all altruistic as well, or is that supposed to be generating licensing revenues? And I'm just wondering, if that's a model we can, is it succeeding, or is it something we should be using, or?
I don't have specific data for you on the stem cell initiative, Senator. We'd be happy to provide that to you and your staff. In this particular case, and has been noted, there are many needs in the state. We talk about that often, both within the full budget committee and in individual subcommittees. In this particular case, they are one-time funds, and so you'll see kind of throughout the framework of our budget, we have made, some investments in one-time investments, and we felt that this was appropriate. But to your point about stem cell, we'd be happy to look at that and get that back to you. I'd also note that our draft trailer bill language does include some reporting requirements for this funding to the issue that several of you have raised.
So then, Mr. Euler, when was the last time the LAO did an analysis or a report on the Prop 71 activities?
I'm not certain about that. I'm not even certain that that's something that we've ever done. That I'd need to get back with you on that.
Okay, well, maybe you could look at it, put it on your list, and say, okay, when we make investments with taxpayer dollars, what are we trying to do? What are our outcomes? What are our expectations? And if we're looking at licensing agreements and generating revenue sources, that sort of makes sense. But if we're just doing it just because we're altruistic, I would have to agree with some of my colleagues that we've got other needs. So I think I made my point, Mr. Chair. Thank you very much.
I have a question.
Pavley and then Senator Pan.
Just a question for point of clarification. I remember when the stem cell research program was passed. I think it was on the ballot by voters. I was surprised after it passed how much of the money was expended out of state and actually out of our country. I hadn't realized that where the money had gone and how it was appropriated. I had assumed as a voter that it was being spent for research conducted in our state. Are there any parameters on this?
Yes, the parameters are such that it has to be, we're looking at education institutions in state to be the primary.
Well, you said such as the University of California, and that sounded vague, or that's how the description was for me.
Okay, I apologize. So the education institutions in state, some of the partners at this point, partners have all been in-state, as far as I know. They have looked to maybe include the University of Colorado in one of the studies, just as a partner contributing information from a similar study that's going on there. But as of right now, the two demonstration projects were run by UC Santa Cruz and UC San Francisco.
Just note that if this moves forward, I'm not supporting it today, but if this moves forward, lessons learned from the past, we need to make sure that there's clear indications of where the money is expended, because our taxpayers are paying for it.
So noted. Senator Pan.
Thank you. I did have a question for the Department of Finance, since that, we're talking about this as if, to a certain degree, the sum of money here compared to the amount of money that's focused on precision medicine overall is actually fairly small. I know people talked about things like travel and hotels and food and so forth, but and we've talked a lot about, well, is the state putting sort of money for direct research? And some of it is going to, I understand, demonstration projects like last year. I guess the question is that, in many ways, precision medicine, and we can argue about where we put money for research and so forth, but anyways, it's taking two areas where we are world leaders, which is biotech and information technology. It's actually the kind of the coming together of the two. And certainly I hope California will maintain its lead not only in both, but in the intersection, which is precision medicine. Can you talk maybe a little bit about how this funding actually gives state leadership in terms of coordinating some of these activities when the state and convening people who are doing this kind of work in California? Because I know we have a lot of your universities are involved in that. We have a lot of companies, and both our biotech and information technology fields, world-leading companies here in California, and our opportunity to be sure that California is a leader in precision medicine.
Thank you, Senator. Yes, in fact, you're talking about, here, just alone, we have, UC Santa Cruz and UCSF having led projects. You also have Stanford and USC having participated in projects. In addition to that, when the UC Santa Cruz project hosted, after posting some initial results from across the world, they had literally world leaders in biotech research and in information technology from the Silicon Valley, from as far away as Sweden and Norway, come in to visit. And to try and garner what we're doing and what exactly we're moving forward to hope to replicate similar things. You had the United Kingdom come out to see exactly what we're doing in relation to precision medicine. It really is an initiative, like you said, that is a confluence that is unique in this state between having the huge information technology component that we have here, as well as biotech and quite frankly, very, very good medical schools that allow us to move these initiatives forward. We have set ourselves up really in a very fine way right now with these demonstration projects of being on the cutting edge of what is precision medicine in the country.
So I just want to clarify, the administrative money is not merely to administer research grants, but it's actually also to perform this convening function and so forth.
Exactly, and those, as I mentioned, those doctors that you bring in, those are the exact same doctors who have to peer review the very criteria that are coming out of the demonstration projects. So there's got to be some give and take there, and be able to get them in and hear the projects and see firsthand what's going on.
Okay, all right. Well, I appreciate that explanation. I will just make a comment that because we heard in budgets up for, and to a certain degree, I do agree with Senator Roth that. I also, I appreciate the administration and the governor wanting to be sure that California is a leader in this field and that we maintain our leadership in these very important areas, even as we're developing, for example, new technologies and new ways to treat kids with cancer and other things, which are certainly of tremendous value both to our state and to our country and the world. We also need to ensure that we work to be sure that all those wonderful things we invent and discover that our Californians actually have access to those, which, we still have to push back on being sure we have the health professionals, including doctors, to deliver them. We need to be sure that the payments are there. So there would be no greater shame than to have research where we develop new treatments, and yet our very own Californians can't access them because our state programs to provide access to that care is not sufficient enough to be sure they have direct access. So, I do welcome personally the governor's interest in this. I do think it's a worthy area to look at, but I also hope as we look at the whole budget that I would hope that there's also equal leadership in ensuring that people have access to not only, of course, health care, but also as we look at things like social determinants of health, what's housing, and that's childcare and lots of other things that we also take leadership in that regard. But I appreciate the explanation. Thank you.
Thank you, Senator Pan. We have Senators Hancock, Monning, and Roth.
Thank you, Mr. Chair. We may be, my microphone isn't going on, I don't think. Oh, there it goes. Thank you. we may be beginning to repeat ourselves here, but the thing that occurs to me is the immense value that might happen next year from a full policy discussion of the issues that have been raised. Clearly, we need policy oversight. We need a framework for prioritizing, I think, not only medical investments and other state investments, but a discussion about where we go as a state in terms of long-term investment in things like medical research and short-term investment in the immediate human needs of our families. We have a number of issues that have been raised about childcare, about after-school programs, so that families can immediately get to a job, so that hopefully they could have health insurance and they could access these things. Again, nobody doubts that this would be a good thing to do in a perfect world, but it raises some very important issues for further discussion.
Thank you, Senator Hancock. Senator Monning.
Thank you, Mr. Chair. I appreciate the discussion around this, and I agree with many of the questions or concerns raised by staff and the LAO. I do think it would be helpful if there were more specific information about some of the benefits of the research. I think to juxtapose altruistic versus some patent or proprietary value misses the boat a little bit, because I think altruistic is very broad. I know some of the work being done at UC Santa Cruz is very focused on tumor research in children, infants with cancer diagnosis. And it's not just a research area, it's an evaluation tool now that has resulted in using proper and appropriate treatment that has actually led to cure of children with cancer diagnosis, because of the ability to use the types of evaluation, DNA analysis, and knowledge of the different, I'm not the doctor, but I know my layman's understanding is the ability to segregate different types of tumors and guide treating physicians with families to an appropriate course of treatment that has indeed been life-saving. And so I do think it's an important pathway for the state to support and be part of. And yet I don't think the proposal before us today is fleshed out to the point of having some of those articulated benefits that are really health care benefits and life-saving benefits. So I do share the concerns. I just wanted to offer that perspective that I think should continue to focus our interest in this area. And as I think, as the chair, maybe others have recommended, maybe Senator Hancock, that this would be an appropriate subject for us to continue to look at in the coming budget cycle. Thank you, Mr. Chair.
Thank you, Senator Monning. Senator Roth.
Thank you, Mr. Chair. I think my comments may perhaps go to the administration, and it's not a question, but rather comments. I'm fascinated by the fact that we sit in here, those of us on the dais and you down there, talking about doctors performing research when outside of this building, many folks are focused on how to directly deliver healthcare services to people up and down the state, mostly in the inland areas, who live in underserved communities. We have, over the next decade or more, we're going to be hundreds and hundreds and hundreds of physicians short, boots on the ground, delivering these healthcare, badly needed healthcare services. At the end of this year, we will lose $40 million in medical residency dollars out of the Song-Brown Fund, and not $1 has been proposed by the administration, either in the January budget or in the May revision to the budget, to replenish that $40 million in the Song-Brown Fund to provide badly needed medical residency programs to put doctors' boots on the ground up and down the state. Just focus on the fact that this $10 million that's being requested here, if it costs for a residency, and certainly Senator Pan has more accurate numbers than I do, but if it's $100,000 a physician, and I'm a lawyer, not a mathematician, but that's 100 doctors that you could train for 1 year. So I'm just really fascinated by this request, given the need in the state, not only for healthcare services, Denti-Cal, Medicare, Medi-Cal, whatever, but the need to train doctors to provide those services. Thank you, Mr. Chair.
Thank you, Senator Roth. We've had a full conversation here. Unless there are any other questions from the committee, we do have a motion from Senator Wolk. Listen carefully, please. The motion is to reject the action of the Budget Subcommittee. So this would be to reject the administration's proposal. Call the roll, please. Aye.
Nielsen?
Aye.
Allen? Anderson? Bell? Block? Glazer? Hancock? Mitchell? Monning? Morlock? Wynn? Pan? Pavley? Roth? Roth? Stone? Wolk?
The motion to reject is passed 14-0. So we're going to stay out of order for just two more issues, colleagues. Going next to issue 14, which is the Governor's Office of Business and Economic Development, clarification of California Competes Authority, and that's on page 17. So issue 14, page 17.